Whether it's a fall off a ladder, a tumble down the stairs, or a trip over a rug, falls can lead to death or debilitating life-altering injuries. And the risk for falls does not vanish when patients are under the care of medical professionals. Indeed, protecting patients from falls has long been a concern of hospitals and healthcare providers around the globe. It's the reason why Christiana Care Health System has been partnering with our patients to protect them from falls. Commonly associated with older patients, this unfortunate occurrence can affect all ages and is not just confined to elderly care. In fact, almost any patient under a physician's care can be at risk for falls. It's a risk that hospitals throughout the nation face with almost every patient they encounter, regardless of age.
Nationally, according to the CDC, about 20 to 30% of patients will sustain a moderate to severe injury. Our numbers are not that high at Christiana Care, thankfully, but we've worked hard to maintain that our numbers are not that high.
Christiana Care's commitment to patient safety and awareness of the consequences these falls can have on patients, their families, and the hospital staff has been the driving force behind the health system's efforts to address this important quality of care issue.
It's something that we emphasize with our patients and also with the patient's family when they are first admitted to the hospital, that because they are in a new environment, that they are on different medications. We want to ensure that they receive the safest patient care possible while they're here. We do not want to do any harm to them. So it is essential that they're aware that they might have a fall, that they are even at high risk for falls. Some patients are not always aware of that.
It also may keep them from returning back to work or being able to provide for their families. And so there are many implications when somebody has a fall.
Christiana Care partners with its patients to reduce their risk of falling while under the staff's care. Once patients are admitted to Christiana Hospital or Wilmington Hospital, the staff performs a validated, individualized assessment on each patient to understand their risk of falling. Using a multifaceted, evidence-based scoring method, patients are evaluated for their mobility, mental status, and their prior fall history. They're also evaluated to determine whether they're on any medications that could impair their balance and their ability to use the bathroom without assistance. The staff also customizes a plan of care to prevent falls in patients whose scores indicate that they are at a higher risk of falling.
We do take a lot of proactive steps and strategies to evaluate their fall risk while they're here. Some of the things that we do is that we use identification bands that we place on their wrists so that anybody who comes in contact with a patient, whether in the unit or whether they're outside off the floor getting tests or procedures, know that that patient's a high fall risk. We use visual cue cards outside of the room so that anybody who's coming into that room knows that the patient's a high fall risk. We also have videos through our Get Well network, which is through our television system that we can play videos for the patients and families to alert them when to use their call bell, when to ask for help, so that they know that they're a high fall risk and we want to prevent them from falling.
Christiana Care has really taken the approach of implementing a validated fall risk assessment. That fall risk assessment takes into consideration a variety of things such as medications, previous falls at home. So that fall risk assessment is used to really be able to have a complete picture of the patient. And if medications are a contributing factor or could be a contributing factor to a patient's fall, they are used in having an electronic consult sent to a pharmacist to allow for a medication review in those patients who have either fallen or have a high risk of falls based on the validated risk assessment.
Patients have a varying level of fall risk depending on their vulnerabilities, so Christiana Care develops a multi-pronged approach to prevent falls from occurring. Tubes that are unnecessary and that may tether the patient to the bed are removed. In addition, a mobility assessment is performed on the patient to determine how much help they'll need in exiting their bed.
It's very patient and family centered. We want to provide the best care for them while they're here. We keep the patient's bedside table close to them, make sure that their TV and telephone are within reach. We make sure, especially our elderly patients, they have their glasses, their hearing aids, anything that they need to see, hear, move better are all within their reach. All of our patients are provided skidded slipper socks so that they have a good grip and are able to not slip on the floor surfaces. We do notify the families as well so that they know that if their family member is a high fall risk, please don't try to get them out of bed by themselves. Please call for the nurse. The nurses also implement a toileting schedule. So a nurse or a patient care tech is in that room every hour on the hour. And we ask them, is there anything we can get for you? Do you need to use the bathroom at this time? We assess the patient's blood pressure in various positions. We check them lying, we check them sitting, and then we check them standing. If we notice that there's a significant difference in those blood pressures, we put them on high fall precautions, and we implement some of these things that we've talked about, the bed exit alarm, using gait belts, those kinds of things to prevent our patients from falling.
To continually monitor the care of patients, doctors, nurses, pharmacists, and other staff together visit each patient's room to evaluate them on a daily basis. This patient safety initiative is known as multidisciplinary team-based rounding. Regular checking in with patients in their rooms by nursing staff at hourly intervals also help patients know they can expect regular assistance while in their rooms. Research shows that these interventions reduce falls within hospitals. Christiana Care also has invested in technology and devices to further reduce the risk of patients falling and injuring themselves. Every patient room is equipped with a lift that staff can use to safely assist their patients to help them when they need to leave their bed. For patients who need supervision or hands-on guidance, staff use gait belts to steady patients as they're assisted out of a chair or bed.
The beds are always kept in the lowest position so that patients aren't sitting high in the sky. We also have low beds available for our elderly patients. Patients who are a very high fall risk, we will actually mobilize them and put them into the nursing unit with us so that they're in direct visual contact with the nurse all the time. We also use chair and bed exit alarms so that if the patient is in the hallway with us but a nurse has to attend to another patient, if the patient attempts to stand, the alarm goes off and it gives us time to respond.
A patient's risk of falls will be reassessed as their condition changes. To continue to build upon their fall prevention initiatives, value improvement teams on every patient care unit at both Christiana Hospital and Wilmington Hospital identify and apply evidence-based ways to further protect our patients from falling.
Each unit has a value improvement team that is charged with looking at the data each month, evaluating the falls, seeing what went wrong maybe, where we can make changes or where we can make improvements to make things better.
This level of comprehensive health care has resulted in Christiana Care being designated as a Magnet organization, the gold standard recognition for nursing excellence. Magnet identifies healthcare organizations that epitomize outstanding quality and professionalism, and this level of recognition does not occur without a solid strategy and powerful plan of execution.
Here at Christiana Care, we're happy to say that we are a Magnet system here, which is a measure that kind of looks at the quality and safety of our patient care. Falls obviously is incorporated into that because it is a measurement of quality and safety of the care that our patients receive here.
Though minimizing patient falls is just one of many elements of patient care that we focus on at Christiana Care, it does provide a great example of how our promise to our patients is put into practice.
It is neat for me to participate in the care of this patient from admission to discharge, to see how they've grown, how they've improved, to get to know my patients, and most of all, to know that I've provided them with very safe care and that they're walking out of here better than they did when they came in.
It's really not just I'm going to prescribe a medication and I'm going to leave you alone and not follow up with you. It's really that follow-up is really key in addressing whether a patient is going to be at increased risk of falls later on.
We are not doing the same things we did 5 or 10 years ago. It's a health system that moves forward when we go onto the patient care units.